Hi, my name is Miranda Lamb, and my research topic is about opioids, specifically their biological interaction with your body. But I didn't want to just give you a lecture. So instead, I want to tell you about a story where you are the main character. Imagine this. You are a college athlete, you love your sport, and you have a very promising career ahead of you. But one night, on your way to a big game, an accident occurs. You never saw it coming, no one did, but it happens all in the blink of an eye. All you see is darkness. You aren't sure what happened, but you don't feel any pain. It's kind of peaceful, actually. It's a bit of a relief from the stress you've started to feel since finals started. What is that sound, though? That buzzing sound? It's so annoying that it wakes you up from that deep abyss. As soon as you open your eyes, you see the big fluorescent light above you, the source of the annoying buzzing sound. And then you notice the white, hot pain that seems to be everywhere, your neck, your spine, your legs. And then you remember the accident, the bright headlights, and the sound of crushing metal. A doctor comes through the door right at that moment. She's happy you're awake, and she asks if you remember what happened to you. You only remember that you were in an accident. She tells you that you were in pretty bad shape when you came in, and it took surgery to fix you up. Because of that trauma, she's going to prescribe you a pretty strong painkiller. You tell her that you're in so much pain that you can't really think straight at the moment. She rounds your bed to an IV bag that you hadn't noticed before. She pushes a button, and you start to feel a bit drowsy, but the pain subsides. It's morphine, she tells you. It is very similar to the medicine that she will prescribe for you to use at home. It will help you to cope with the pain as you recover, but you have to be careful because it can become highly addictive if you use it improperly. That sounds really intimidating, so you ask her for a better explanation of these drugs. Opioids, she calls them, very strong painkillers that use opium, a natural extract found in opium poppies. It is a chemical that can be helpful for coping with pain because of the way that it mimics endorphins, which are your body's natural pain-tempering hormones such as adrenaline and noradrenaline. She explains that your brain has tiny opioid receptors. Endorphins like adrenaline bind to them and activate them. This releases dopamine, or the happy hormone, and helps to block pain signals. Opioids bind to these receptors more tightly and hold on longer. Because of this, they can be used to treat more severe pain. Well, that doesn't sound so bad. What's wrong with being so happy that you can't even feel pain? That doesn't sound dangerous to you at all, but she assures you that it can be. Not because of the happiness per se, but because those receptors also help to regulate many of your normal bodily functions. Those receptors also regulate noradrenaline levels. Noradrenaline is a hormone that influences your heart, lungs, and even your digestive system. It stimulates these for normal functions such as breathing, digestion, blood pressure, and heart rate. Opioids suppress the levels of noradrenaline, and a large dose can actually lower breathing and heart rate significantly. You assure her that you'll strictly abide by the dosage guidelines, but that's not all that she's worried about. She reminds you to only use the medication when you need it because consistent use over long periods of time can force your body to develop a tolerance. This can actually lead to dependence for normal day-to-day functioning. Your body learns to tolerate this imbalance of necessary hormones in two different ways. Your body may start to remove opioid receptors, or these receptors may simply become less responsive. Either way, this leads to your body needing a higher dosage of the medication in order to experience the same effects. You tell her that if you find yourself taking too much, too often, you'll just stop. That's the easiest way, after all. You'll just have to buck up and deal with the pain. But she pleads for you to not do that. You can make yourself really sick, she says. But how, you wonder? When your body learns to tolerate the effects of opioids, it becomes highly sensitive to lower concentrations of suppressed hormones in your body such as noradrenaline. If a dependent person stops taking their medication abruptly, this new balance that the body has adjusted to is turned upside down. An opioid-dependent person will soon experience withdrawal symptoms after stopping their medication. Different drugs cause slightly different withdrawal symptoms, but opioid withdrawal is usually characterized by anxiety, vomiting, sweating, elevated heart and breathing rate, and even insomnia. These withdrawal symptoms can become so extreme or uncomfortable that people choose to use illicit drugs rather than to face them. Many people turn to these illicit drugs because they are cheaper and easier to access. She tells you that 80% of heroin abusers actually became addicted to prescription opioids first. You thank the doctor for her patience and willingness to explain everything to you. She assures you that she would rather have you ask questions and be aware of the consequences instead of accidentally finding yourself in a preventable situation. She makes sure you don't have any more questions before she leaves to allow you to make arrangements for going home. As you pick up your prescription at the pharmacy, you wonder how such a powerful and dangerous substance can be contained in such a tiny pill. If that doctor had not taken the time to break it down and make sure you understood the danger of not being careful, you could have been blindsided by an awful situation. Over the course of several months, you take special care to monitor your intake of that medication. You make a pretty quick recovery, and though your body will always bear the scars and a little bit of discomfort, you soon return to doing exactly what you love to do.